Medical Professionals Union SAMATU plans to march to the Health Department on Thursday. It is demanding government keep its promise to find jobs for doctors who have completed community service.
But the department says it's made no such commitment. It also says it only learned of the planned march through social media. Let's find out more from Dr. Percy Mahlati, the DDG for Hospital Services. A very good morning to you, Dr. Mahlati. Thank you so much for your time. It's seeming like a he says, she says situation here. The department saying that they are finding out about this march on social media. The department saying that they actually did not make such a commitment. And then, of course, SAMATU saying that you actually did. And we probably did notify you of this particular march. Who's telling the truth?
Well, good morning, Mutupi and Faith and the viewers. I think, first of all, I would like to emphasize that the challenges that are facing the health system from a staffing point of view are well known, and we agree that many of these have actually become chronic. But coming specifically to the issue of SAMATU, sometime in December, around about the third week of December, SAMATU raised the issue, and at that time they said there were 200 unemployed doctors. Suddenly, as the department, we then said, kindly provide us with a list, but with the following details. One of those details was clear contact details, full names, and the HPCSA registration number. The intention was to then take that list and share with the provinces, because the national department does not run physically the hospitals, but it's the provinces. And at that time, the Limpopo Department of Health had advertised a number of codes, including those of medical doctors. So our intention was then to share those across the provinces. What we received was a very disappointing list. On the list, they would say Dr. Sipo, no contact details, no HPCSA number. Some of them, it would be Dr. Mahlati at this hospital, no contact details. Now, why did we want those contact details? We wanted them to make sure that when we then send that list to the provinces, we know that we're sending lists of people that are properly registered with the Medical and Dental Board of the Health Professions Council. Well, we wrote back to them and pointed out those glaring, problems. Sometime in January, I think I would say about 2 weeks ago, a post in the social media came up in a WhatsApp group of mainly health activists, medical doctors, which was now claiming that there are 400 unemployed doctors. And I responded to that, and I did say, and I would repeat, that government has got a statutory obligation to employ interns for 2 years, which is, that's part of training, then community service. After community service, there is no legal obligation to employ. However, there is a moral obligation to employ. That moral obligation is underpinned by the availability of budgets, because you cannot employ somebody, then you say, no, look, I don't have money to pay you. And that is a chronic struggle that we're actually dealing with. So the last part of what you raised about hearing this on social media, I saw the post on social media. There is no record that SAMATU has engaged, with the National Department of Health to actually say, look, this is what we're planning to do on the 26th for these particular reasons and all that. So that is the facts as far as we know as the National Department of Health.
Yeah. Dr. Percy, you're speaking here about some of the chronic issues that you're dealing with, especially as a department. Now, obviously know that, and as you've elaborated, that the provinces will be responsible largely for being able to hire some of these doctors. But I guess the big question is that, does the department even have a budget so that you can have that moral obligation undertaken? I hear about the legalities in it, but I think the bigger question is we've already got an ailing infrastructure problem when it comes to our healthcare facilities. We already have a strained public healthcare system, really strained, needing resources of all kinds. But actually, do you guys have budget? Do you have budget?
Yes, we have budget, but the budget is not enough. Every year, there is an increase in the number of doctors that graduate from medical school. We graduate just less about 3,000, and then you add others that come in. And unfortunately, the economic situation of the country is a challenge. And that budget, we must share it between doctors, nurses, pharmacists, and everybody. And you will know, Faith, that there is constant concerns about the shortage of nurses in the public health sector. So we've got to try and balance all that together. That is why in our statement, we made emphasis on the fact that our Minister of Health continues to butt heads with Treasury to actually say the state has a responsibility in terms of Section 27 to provide health services, and we must actually be properly funded. But unfortunately, there are so many competing interests and all that. So we continue to try and work hard, and also trying to see where savings could be made so that we could be able to fund the employment of health professionals equitably, not just in the medical field, not just in the nursing field, but right across the board. So there is a lot that, we continue doing, and certainly the budgets are not enough.
You know, I want to labor on the point that Faith was making, Dr. Percy Mahlati, about the strained health system. Just how strained is it now? I mean, we are not out of the COVID-19 pandemic. I would want South Africans to not, get woozy about that idea. We are still in this pandemic. It may not be as devastating as it was a year to 2 years ago, but just how strained is the healthcare system right now in 2023?
Yes, Mutupi was strained. It would be difficult to say what the levels of strain are. But let me just, share with you what the major challenge. The challenges are, of course, we've spoken about the human resource challenges, the expertise that we require, because we need a lot of specialists in the public health sector. If you will notice over the years, many of the specialists have moved more to the private sector. That talks to a number of issues, retention, and so on. But we've got challenges with infrastructure. We've got hospitals and clinics that are more than 50, 60 years, but we don't have enough infrastructure budget to deal with those. But let's come now to the disease problems that we have. Yes, we focused a lot on COVID, but the problem that we have is that if we don't have a balanced approach to the provision of health services, we would end up focusing on one type of condition. For example, yes, COVID was a catastrophe for the whole world. But what we found was that there are other, conditions like your TB, your diabetes, your hypertension, that those programs suffered because of, rightfully so, focus on an emergency. So what basically one would want to say is that even though there is a major focus on emerging, pandemics or problems we have, we need not forget that we still have, the potential to have measles, choleras, your non-communicable diseases are still there and they need to be taken care of. And all those have to be funded. And we actually have to make sure that we've got the right expertise to be able to deal with those particular, matters, which then goes back to the kind of training that we provide our health professionals. Because as South Africa, we've got to maintain that broad, grounded training of our health professionals so that they can be able to deal with any condition that they are faced with to the level of their scopes of practice and training. So yes, we are strained, and it's a consistent struggle for us to make sure that we manage things better.
You know, Dr. Percy, this conversation, it's disheartening to have because with the, I think, skeletal infrastructure that we have when it comes to the healthcare facilities as well as public healthcare, especially for South Africans and for the most vulnerable, we do need the resources to be in tune so that we can actually give people the services that they do to. But it can't happen, obviously, because as you're saying, there's money, but there's not enough money. So in that regard, right, these post-community service employment opportunities, can we see those doctors that have finished their community service actually being absorbed into these hospitals and public healthcare facilities this year? And to your understanding, as the department, how many doctors can actually be incubated or absorbed this year alone? I know now this is the moral obligation aspect of it, but how many can we morally have this year that the budget will allow us to actually have in the system?
Well, Faith, let me say that there are many doctors. I may not have the actual figure now, but out of, where the 2,500 community service doctors we had last year, from SAMATU's point of view, there is give and take between 200 and 400 that are not employed, which would mean that you've got about 2,100, 2,200 that have been absorbed in the system. We still are doing the tally from the provinces to actually find out how many have been, because some of them take up employment at the end of January or beginning of February. So it's not to say that when doctors complete community service, nobody is employed. Yes, they are employed, but it may not be the full complement. The second part to your question is that the budgets for employment are held by the provincial health departments. That is why then we play a coordinating role at national level. And certainly, once we get the accurate list, because the list that were given of 200 had gaps and it was not accurate, we would actually engage with the provinces. And we actually, we implore our doctors not to just wait from whatever attempts we do at national level. They should approach the provincial, departments of health and say, I'm available, I would like to apply for a post and all that. And also we need to know that not every doctor who completes community service automatically wants to go and work. We've had a few cases where people after community service, they would stay for about 2-3 years and then go back and study. Some use that 1 year to travel all over the world and so on. So there's various permutations, but certainly we'll do our best with the budgets allowing to convince the provinces that they should employ those doctors, because we need doctors. There's no doubt about that.
Before we let you go, Dr. Percy Mahlati, I'd like to tear away slightly from the topic we are discussing right now and just look at one of the stories that we are touching on and looking at here on eNCA, and that is of the health MEC in Limpopo, Dr. Percy Mahlati, and her sternness on the employers, of course, of the particular hospital that she was at, the Retabile Clinic in Polokwane. We are of a certain idea as broadcasters, Faith and myself, of course, that it shouldn't even be a story because this is an MEC doing her job. But of course, it has got tongues wagging as we put out in our story. What is the national department saying about that video that has gone viral of Dr. Mahlati chastising, what she calls the idle workers and saying that she's not going to apologize for it?
Well, Mutubi, I agree with you. That should not really be a story. However, it is a story now. So let's view it from two, levels. I think the first one is that the MEC has a responsibility for oversight in the hospitals. Some people may disagree with the way that she does it. Others may actually agree. But there is a cause for the MEC to chastise a senior manager. So I think our responsibility from the human resource management point of view is to actually look at, performance management, is to look at, the skills and competencies that people should have. But more than that, as to whether the individuals that get given the responsibility are carrying out their responsibility correctly. So it is likely that there would have to be corrective measures taken, which could either be discipline or training or whatever it is. So we've got to look at this. And this is one matter that has been established before, that we've got challenges with the quality of management of our health services. And it's not only about the MEC. We get complaints all the time about ordinary members of the public, patients, who go to facilities and complain afterwards about the quality that they get. That is why, from a public health service point of view, there are measures and structures in place to make sure that that quality, service is delivered. But of course, we've got to make sure that all the time we're able to reflect, even us as professionals, clinicians, even us as managers, administrators, to actually say, are we really doing our work correctly? So that the chastising will automatically go away. As long as we're not doing our work, there'll be various forms of chastising that come up. And certainly it's a matter that we've got to address, quite strongly.